In Bangladesh, lead poisoning remain a significant public health issue and particularly impacting children and vulnerable communities. Its elevated lead levels have been detected in various environmental sources, including household paints, ceramic toys, cosmetics, and contaminated soil. One of the most prominent sources of the lead exposure is from the improper recycling of used lead acid batteries, which we call ULAB. The current status of lead poisoning in Bangladesh is really alarming, and particularly due to its widespread presence in consumer goods and industrial activities and the informal recycling sector. Despite efforts from organizations like ISDO and international bodies, lead poisoning continues to affect many communities, particularly those involved in battery recycling, pottery, and informal labor. And also, lead poisoning in Bangladesh is a crucial public health issue, especially among children. Lead poisoning in Bangladesh is a critical public health issue, especially among children. According to UNICEF report, around 1 in 3 children globally, up to 8 million, have blood lead levels at or above 5 micrograms per deciliter, the level requiring interventions. Nearly half of these affected children live in South Asia, with Bangladesh being the fourth most seriously impacted country. And as estimated, 5.5 million children in Bangladesh have blood lead levels above 5 deciliter microgram per deciliter, showcasing in severity of the crisis. So I can also share the challenges the here we combating in lead poisoning in Bangladesh. So one is, of course, is lack of the regulation and enforcement. While laws and guidelines exist, enforcement in a very weak informal sector like unregulated battery recycling and e-waste also processing operate with minimum oversight. And awareness and education, public awareness about the dangers of lead poisoning in low, particularly in rural and devastating communities, limited prevention efforts, and limited resources for testing and remediation. It's also really a challenge for, for Bangladesh. And the many communities lack access to testing and remediation measures for lead exposure, leaving them vulnerable to its long-term effects. And industrial resistance from industries that contribute to lead pollution hampers stricter regulation and stalling necessary policy changes. These are mainly the common things we are facing in Bangladesh. And also, one is the important things is limited infrastructure.
Obviously, I mean, we also, as a research institute, look at some of the issues, not only at the field level, but also at the policy level. And one interesting study which we did actually was not because of the lead concern. This was done in 2012. A lot of vegetables are grown in Delhi in Yamuna floodplain. And there were concerns regarding these vegetables, which are largely irrigated using untreated sewage and untreated industrial discharges, and also water sometimes. So we wanted to know what's a concentration in these vegetables which are grown. And also, when the results came, we were surprised that most of the vegetables, especially the leafy vegetables, showed the concentration of heavy metals much higher than the standard. And also the soil in the area where these vegetables were irrigated, grown, was also found to be contaminated. So clearly, and lead was incidental, but there were other heavy metals also a matter of concern. Time to time, there are other institutions in India who have also done studies looking at levels in different products. And as our previous speaker said, the paints, low quality paints especially, are still concerned because they tend to use lead because they want to produce low quality paints. Though the larger manufacturers of paint have already stated that they have phased out lead in the paint. Similarly, in early days, petrol used to be a problem because lead was doped there as anti-knocking agent. But subsequently, India in 2000 phased out lead from the petrol. And also other major source like Bangladesh for the lead to be released in the environment is basically lead acid battery recycling. And we all know, I mean, automobiles largest user of lead acid battery. In India, what's happening is, though we are moving towards adoption of electric vehicles, but in electric vehicles, there are a lot of configurations For example, standard configurations, they use lithium-ion battery for power storage. But for smaller e-rickshaws, which are cheaper versions of electric vehicles, they still use lead-acid battery for power storage. So that is a concern. And also leakage of, though I mean the regulation on lead acid battery management, it came as early as around 2001 in India. And this was, if you see the way it was structured, I'm sure it must have been structured in many other countries as well, was for the first time EPR was being looked at, extended producer responsibility. And rules essentially mandate that you cannot get a new battery from the market unless you surrender your old one. Rule in principle is fine, but what in practice happens is, customer surrenders a battery and gets a new one, gets some discount on the new battery, but the retailers who take the old battery often leak it to informal lead acid battery recyclers, and it's very difficult to basically monitor them, check if all the batteries are going back to formal recyclers, or some leakage in the system is happening where informal recyclers also getting some batteries to be broken up and lead being recycled. That is where it's a big issue, and that is where proper monitoring and regulatory compliance, tightening the regulatory compliance would be required. Not only that, what we actually 3 years back, we under Norwegian government project, we also looked at what is going to happen when large scale electric vehicles are introduced in the country, and large scale solar installations are going to be introduced in the country, which will use batteries as storage sources. And in that, we realized that lead acid batteries also would be a significant part, because smaller solar installations would not go for lithium, and smaller EV vehicles will not go for lithium, especially e-rickshaw kind of installations. So lead acid batteries are going to stay for some time, and that is where what is required as per regulation is that informal lead acid battery recycling has to be completely phased out. There's no other option but to completely phase them out from recycling activities, and that is where rule needs to basically look at. Battery waste recycling rules have been again revised in 2022 in India, and it's also talking of making EPR, extended producer responsibility, more effective. But it has to be something like what has been done in e-waste and what has been done in plastic waste, where the manufacturers, here we call them original equipment manufacturers, those who use lead acid batteries in their product.
CFED studies on lead in paint, cosmetics, artificial jewelry, toys, Ayurvedic medicine, even the very popular snacks like noodles has shown very high level of lead content, and these entities are serving as a source of lead poisoning in addition to occupational lead poisoning in the battery recycling and then other industrial setup. Even the recent pure earth studies have also found out like ceramic, metallic, and plastic foodware are heavily contaminated with lead, and that is also huge contribution towards lead poisoning in addition to the source I already spoken earlier. And as we have the diverse sources of the lead poisoning, there are a couple of studies has been happened in Nepal that clearly shows very high level of blood lead level among the children, and there are number of studies that has clearly illustrated that more than 65% of the studied population have got very high level of elevated lead level, more than 5 microgram per deciliter, and even certain cities like industrial city like Birganj have even 100% of the studied population has very high level of more than even 10 microgram per deciliter blood lead level among the studied population. Not only that, we have studied the painters have increased level of BLL. Even waste worker who work with the collecting, sorting, and recycling of the waste, including electronic waste, has even elevated level of lead more than 12 0.89 ppm. Even patient consuming prescribed Ayurvedic medicine by registered Ayurvedic doctor has got lead and intoxication cases in Nepal just by consuming prescribed Ayurvedic medicine. And even in that case, we particularly follow up the patient, and even we tested the what they are consuming, the prescribed Ayurvedic medicine, and he was given prescribed 7 Ayurvedic medicine, and we able to test those all 7 Ayurvedic medicine, and 6 out of 7 Ayurvedic medicine the particular patient has prescribed to consume has got more than 10 ppm of lead content. So even the medicine kind of things is becoming the increased source of lead poisoning in case of Nepal. Even the same group of medicine fraternity has come up with the new findings, and that clearly also gave the another pictures like there is a increased trend of consuming way drugs that aim for weight loss, and there are number of people, even more than 15 people has been traced having more than 65 microgram per deciliter blood lead level just by consuming medicine aimed for their weight loss. So these are, and then even just the last year we have from the CFED conducted the blood lead level among the used lead acid battery recycling in one of the recycling facilities in Nepal, and maximum of the blood lead level among the workers was even more than 100 ppm. With the support of various organizations including IPEN and WHO, data generation, source identification, successful policy intervention of lead paint standard, and even follow up, we are doing a lot of compliance monitoring to make sure to reduce the level of lead in the most of the potential source. So these, and along with the massive campaign of awareness, raising capacity building right from government up to the paint industry, painters, and even the general public. So these are the initiatives.
In 2020, the toxic to the report revealed that 36 million children are poisoned by lead. That is, the standard is 5 microgram per deciliter, and in globally there were 800 million children. They have high blood lead level. So, out of 800 million, 36 million children that belong to Bangladesh population. In that report, they have also revealed that the average blood lead level is 6.8 microgram per deciliter, when WHO reference value is 5 microgram per deciliter. In Bangladesh, the recent Lancet report revealed that the children, they are under 5 children, they have lost 20 million IQ point. Just I like to mention that the difference between lead exposure in high income country, difference between lead exposure in low income countries, there is a difference between 20% IQ loss. I mean, if a children in high income country exposed to lead, if a children exposed to low income country are exposed to high lead, the IQ difference is still 20% the in low income country. That's why in low income country we are taking it seriously to how we can mitigate the lead poisoning. So in so far, the Lancet report also revealed that the lead is not neurotoxic, not only work with child intelligence, it has also adult effect like cardiovascular effect. I think Niti has mentioned that the slow effect of hypertension and memory loss. So we have seen that the 138,000 cardiovascular death can occur due to lead poisoning. The combined cost of lead exposure is $28,000 million. That is 9% of the total Bangladesh country's GDP, and 70% of the intellectual disability in Bangladesh, that is due to lead. So lead is very popular for its neurotoxic effect. Next slide. So whenever we discuss about lead, so first we discuss about the exposure. The first exposure comes from paint. The second exposure comes from lead acid battery. But there are many other sources that can trigger high lead. That is aluminum cookware, the ceramic industry, the paint, the the colored toys, and also the spices. Currently the Bangladesh, and we have done the next slide. Currently in Bangladesh, we have identified 300 polluted sites. That site contains the used lead acid battery factories, their legacy. So in toxic site identification program, we have identified these sites, that the sites contact the surrounding soil, surrounding population, they are exposed to high lead. We have assessed 250 homes for exposure assessment source. We have, together with DGM, we have tested 3,200 blood lead level, and we have so far remediated or cleaned up 86,000 square meter soil in Bangladesh, and we have a plan to clean up another 100,000 square meter soil, remediated, clean up toxic sites. So we have almost tested 196 household items throughout Bangladesh, and we have initiated or generated 20 awareness events. That awareness events in especially policy level, high level awareness event, there are community level awareness event. So in so far we have engaged the civil society and the community and government staff to produce 20 events for awareness raising. Next slide, please. So in Pure works in five steps. The number one, we go for source analysis. For source analysis, we have identified the toxic site identification program. We have identified 300 toxic sites, and we have also analyzed 200 household items throughout the market to see lead contamination in the household items. And we also try to identify the rapid market screening to see the lead contaminated items in the market that is available, that is consumed by the population. Next slide. The phase two, once we identified the source, we try to go for a source specific intervention. So currently we have, as I mentioned, we have cleaned up or remediated 80,000 square meter. So we go for remediated cleanup sites. So we identified 300 toxic sites. So we have a plan that we will remediate all these sites together with the government, so that there will be no contaminated soil in Bangladesh. Next slide. That is an impact of three contaminated site. The upper portion is the contaminated site. After the cleanup, we have seen the severe greenery plantation in the contaminated site. So our idea is, if we remediate all the sites, there will be a possibility that the contaminated site will produce the greenery fruits that would be lead free. Next slide, please. So third stage is we go for a blood level testing. That for BLL testing, we initially collaborated, partnering with government and also the international institute like ICDDRB. We go and collect the blood, and we also test the blood. The blood level tells us the exposure distribution of the community.
So, sorry to interrupt. Will you wrap it up?
Oh yeah. So fourth one is the communication and public education for remediating the lead contaminated areas. So we go for a communication and public education in the community, or also in the high government staff. So this is the sustainable solution, engaging with government, and what are the methods, what are the ways we can remediate, we can mitigate the lead polluted site, that we go for stakeholder meetings or engagement with the government. Next slide, please. So partnering with government, we usually partnered with Department of Environment. There is a government institute. They are responsible for exposure, not only lead, all heavy metals or poisoning cases.
IPEN and its participating NGOs in about 60 mostly low and middle income countries have been actively promoting the global elimination of in paint, or including the manufacture, sale, and use since 2007. And based on IPEN's research studies on lead in paint in South Asia, we still see that lead paint remains for sale in the markets of Bangladesh, Nepal, Sri Lanka, India, and Pakistan, even after regulations were adopted in these countries. IPEN NGOs in these countries shared research findings as well as recommendations to relevant government ministries and departments. IPEN NGOs also raise public awareness about the importance of eliminating lead in paint in traditional and online media. In some cases, IPEN NGOs also share the findings with paint manufacturers and paint industry associations and conduct follow-up activities with these individual paint manufacturers whose paints were found to contain high levels of lead. Once follow-up mechanisms or communications were made, IPEN NGOs then encourage manufacturers to reformulate their paints and share with them technical know-how and provide manufacturers access to suppliers of alternative ingredients to lead. In 2015, IPEN instituted a lead-safe paint certification program based on 90 ppm total lead standard. Now, 6 paint manufacturers representing over 90% of paint manufacturers in the Philippines have been certified under the program. And one more manufacturer is currently undertaking the process of getting their paints certified. The program is also ongoing in Sri Lanka. We also worked before in Bangladesh, and we are now in discussion with Quality Council of India to start this third-party voluntary certification. In the past 2 years, IPEN has been working with our partner NGOs in select countries with existing lead paint regulations to encourage their government to submit notifications to list lead chromates under the Rotterdam Convention. In April of 2024, the good news is that the government of Cameroon has submitted a lead chromate notification. Another country in another region needs to submit a similar lead chromate notification for the process to move forward.
The lead is still part of our daily life, and it has been widely used in the paints, cosmetics, ceramics, batteries, e-waste, recyclings, and many others. Here, I would like to mention that there are several studies. So we know the different kinds of the sources of the lead poisoning in the Nepal. And the WHO, from WHO perspective, we are saying that there is no safe level of the lead. But even if we consider the 5 microgram per deciliter is an indicator in our studies, which have been conducted in Nepal, clearly shows that in some cases, in the 100% cases, the BLL was very high. In some cases, it was 62% or something like this. We also know that very recently in 2020, UNICEF and the PRR carried out a global study, which also estimated that over 65% of the total cell population of Nepal have elevated BLL. So that is the reality. When we talk about the challenges, basically it's the lack of awareness among the people, general public, and also among the officials, especially on the health impacts of the lead poisoning and the use of the lead. But at the same time, we know that lead poisoning is preventable, and there are good alternatives, and we can go without using the lead. But this message has to be communicated, and this message has to be communicated to the general people consistently. We also know that there are some commitments at higher level, but these commitments have to be materialized. And also at the same time in Nepal, although we know there are different sources of the lead poisoning, but we have the only one standard, that is the lead in paint. When you see the status of the enforcement, we carried out compliance monitoring in 2021, and it shows that there are still the 48% is non-compliance. The other important part is that in Nepal, the non-communicable diseases have been increasing, and it is about 71%. But when we see the non-communicable disease risk factors, basically they are tobacco, alcohol, physical inactivity, and unhealthy diet. And very recently, we have been advocating, and now it is included air pollution as one of the risk factors. But still, issues related with chemical safety and cancer are not seriously taken as a sources for the non-communicable disease. But at the same time, we know that only the cancer accounts for about 9% of the total deaths, and it's the third leading cause of the NCD deaths in Nepal. But there are limited research studies linking non-communicable disease with the lead poisoning. That is another issue. The next challenge is...
Please wrap it up in 1 minute. Last 1 minute.
Yes, thank you. So when we talk about the initiative from the WHO, yes, definitely there are global strategy and global roadmap. We have been supporting the government for the implementation of this, and we have been advocating at the different levels. And we also know that every year since 2013, we have been celebrating this international lead on a regular basis. And at the same time, we also have been conducting several research studies that I will brief later. Thank you.
Thank you so much, sir.
Now, we all know there are many sources where the lead can get into the human body. That's through air, soil, water, and a lot more other sources. So, yeah, like the other esteemed speaker said, the main challenge is creating awareness among people, the public. Unfortunately, when I ask, forget asking a random person, when I ask doctors in the hospital, what's your blood level, and they don't know what their blood level is. So the main challenge is making people understand how serious a problem lead toxicity is. Now, we all know there are many sources where the lead can get into the human body. That's through air, soil, water, and a lot more other sources. So, yeah, like the other esteemed speaker said, the main challenge is creating awareness among people, the public. Unfortunately, when I ask, forget asking a random person, when I ask doctors in the hospital, what's your blood level, and they don't know what their blood level is. So the main challenge is making people understand how serious a problem lead toxicity is. And unfortunately, if your body has lead in it, what are the symptoms? There are no symptoms, or every symptom is a symptom of having lead poison. So the main challenge we face, I'm representing NRCLPI, National Reference Center for Lead Projects in India. We also had to change the name from National Reference Center for Lead Poisoning India to Lead Projects in India, because when we go to industries, when we go speak to public, and you say poison, and people take a step back. A lot of corporates don't want to come and collaborate with us because they are also scared. Lead industries are scared. So we had to change the name towards project, and then we started doing a lot of programs to create awareness. We went to industries. We did the hand holding, make them understand how they need to. They have to work. Acid batteries, battery companies have to work. The employees have to work in the industries. So how they need to work? What are the protective gears they need to do? How regularly they need to get their health checked up? And if their lead levels are high, what they need to do, how they have to do the job rotation is what FQI and NRCLPI had to create awareness and tell them what to do.
Okay.
Dr. T. Venkatesh is not here. He's known as the lead man of India. His regards to all the esteemed speakers.
Yes.
He, along with George Foundation in the late 90s and early 2000s, was instrumental in getting unleaded petrol to India.